Welcome to It's Your Case, presented by VetCT.com. I'm Heather. Today's example is an 8-year-old beagle with recent pelvic limb lameness and lethargy. Once you have reviewed the radiographs using your systematic approach, then you're ready to watch this video. To start, I'll simply show you that on the lateral view, you'll note caudal to the urinary bladder at the pelvic inlet, there's increased opacity in the region where we would expect prostate. For an intact dog, it's okay to see the prostate, but in a castrated dog like this one, I don't expect to see the prostate on radiographs at all. So this is extremely large. I also find the opacity to be mildly increased, especially given that the size is smaller than the urinary bladder, but the opacity is slightly greater. This may be partly artifactual due to superimposition of the thigh musculature. Now, although these are abdominal radiographs, I do want to focus a little bit on the bony structures for this case. When I'm looking at osseous features, I try to compare the findings that I see between those that are consistent with an aggressive or a non-aggressive bone lesion. So let's use this as an example to go through my checklist for an aggressive bone lesion. We can all see that the appearance of the left ilium is abnormal when compared to the right. One of the first things that I look for when I'm assessing if a lesion is aggressive or non-aggressive is whether or not there is a periosteal reaction, as well as what type of periosteal reaction I see. So in this case, I can see that there's a periosteal reaction, especially visible on this view on the ilium, and I would characterize it as irregular. That means that if I were to try to trace the periosteal reaction, not only is it difficult to trace and ill-defined, but I actually end up moving my mouse sort of back and forth along the long axis of the bone, more so than progressing longitudinally. Let's see what that area looks like when we go back to the lateral view. So on the lateral view, the periosteal reaction is less apparent, but I can still see a periosteal reaction here, dorsally. So for me, there's definitely a periosteal reaction. Now, on the lateral view, I can see other osseous features are affected by this process, having a periosteal reaction on the ventral aspect of multiple vertebrae. The next thing that I look for when I'm trying to determine if a lesion is aggressive is bone lysis. Bone lysis in this case is most evident probably here, where when I trace the ilium on the lateral view, instead of having a continuous line, I actually see a radiolucent defect. The bone lysis is somewhat less apparent on this view, probably in part due to superimposition of the periosteal reaction. This can be tricky with aggressive lesions. When a periosteal reaction and bone lysis are both present in concert, the two-dimensional appearance on the radiograph can be quite difficult. The next thing I look at is zone of transition. Zone of transition refers to whether the delineation of normal and abnormal bone is sharp or difficult to define. And in this case, I would say it can be quite moderate, meaning that exactly where the pathology of the ilium ends and the appearance of the pubis is possibly more normal is quite difficult to define. The zone of transition is probably more easier assessed on long bones. The next thing that we can assess on this radiographs, but that I want to mention for completeness when I'm assessing for an aggressive bone lesion, is the rate of change over time. If ever you weren't sure whether you're dealing with an aggressive lesion or not, you could re-radiograph the patient depending on clinical situation in anywhere from 1 to 3 weeks. And if the lesion changes substantially in that time, it is more likely to be aggressive. Once I'm satisfied that there's an aggressive lesion, and in this case, I'm very satisfied that there's an aggressive lesion because of the irregular periosteal reaction and the bone lysis, I then categorize it. This one is clearly polyostotic, meaning it involves more than one bone. If I summarize the osseous findings taken together with the prostatic enlargement, this is highly consistent with a primary plus prostatic neoplasm and regional osseous metastasis. Be sure to review the full report for this case for some other minor findings and a brief discussion about these lesions. Thanks for listening, and remember, it's your case, so please post your questions on social media.